So we got 3 topics to talk about today. A little bit about COVID, some fee schedule stuff, and talking about some fires in California, burning down our parks, our wildlife.
Yeah, and the relation of paid time off.
Yeah.
Yeah, with the fires, right? The question is does it affect our outdoorsy ways?
I mean, I can think of it a little bit. It does.
Yeah.
Like my campground that I love to go to is burned down to the ground. We'll talk about that.
Yeah, it sucks. All right, you ready to get started?
Sure.
Okay, I want to welcome our audience. Welcome to the Ready, Set, Gemini podcast. I am your host, Dan Mora, and directly across from me, my co-host,
Frank Smithson over here.
Thank you for joining us. As always, we love your feedback. Please comment in the comment section of the show. We're also looking for future show ideas. Like, follow, comment, subscribe.
Oh, yeah.
Do all that stuff.
Yeah, more comments, the better. We got a few comments on our MedLegal podcasts, and that was interesting.
Nothing super substantial. We were hoping for some banter maybe, and we didn't get any banter.
Yeah, we got one little comical tidbit, but yeah, we want some opinions. Like, are we thinking the right direction? Are we thinking the wrong direction? Are we just missing something entirely? Get that information in and let us know. We can talk about it.
Yeah. So today we have a few topics. We're gonna get a sense for. We're just gonna do a quick COVID, sense where we're at with that. Talk about interesting the rebuttable presumption. Remind our audience about just the basics of how COVID affected workers' compensation.
And a little bit of fee schedule, fine print. It's getting ready to drop here any moment.
Yeah, July 15th.
July 15th. And then we want to talk about some fires that are going on and ripping through California, and maybe kind of relate that to people getting out in the world and taking vacations in these forests and out in California, and maybe tie that into how vacation and work comp are kind of related.
Yeah, I like that.
Employee health type thing.
Employee health.
Yeah.
Retention. What's the buzzword? Engagement. And then
are they thriving?
And thriving.
That might be something we'll talk about. I got to read the article. Microsoft just did a HBR, Harvard Business Review article, and they changed the way that they were thinking about going through employee engagement, understanding, and they want to think of it now in terms of like, how are employees thriving? Yeah.
They're changing the term and
buzzwords.
Yeah, buzzwords.
Yeah.
Cool, man. So how you doing today?
Good. It's been a couple of weeks that we've taken off from the podcast. I just got back from a 2-week vacation. Went through California, Oregon, Washington. Had a good 4th of July. Just went out this last weekend and had a family event in Santa Rosa, which is something we've been doing our entire lives until COVID hit. So this is the first time we've been out there in probably 2 years. So it was really great.
Yeah.
Feel rested.
Yeah, I got some time off as well. Got to see Colorado for the first time outside of Denver, an hour west of Denver, up in the mountains, plus 8,000 feet elevation. It was beautiful. Very nice.
So Wyoming versus Colorado, where are you at now?
Colorado.
Yeah, that's what I was there too. I was thinking the same thing. I was in the San Juan, so I was even more south than you. I was 30 miles north of the New Mexico border.
Yeah, that looks beautiful. I need to visit that area.
I know where the elk are.
Let's do it.
I can put us on elk for sure.
Well, let's talk about why don't we just start there then? Why don't we start with paid time off? You and I did a little bit of research about we got the story. We got the story given to us about the fires and how that affects the outdoor enthusiasts here in California and people trying to come to California for outdoor reasons. Man, we've lived through now, I don't know how many years of drought that has led to then fire seasons that have just been outrageous for the last few years.
Yeah, drought seems like it's now normal.
Yeah.
Maybe is a way to talk about it. I think of the drought starting, man, I guess I still was working at Gemini when I was big into mycology. Right? Like I spent 3 years, like every year, getting hard fall and winter and spring, trying to find mushrooms and studying that. And, you know, when the drought first kicked in, that was like a early symptom is the mushrooms just disappeared. They wouldn't pop up anymore.
Yeah.
And they're very much the indicator of a healthy forest.
Right.
They're the decomposers.
Mm-hmm. And you and I spent a good amount of time in the forests, in the California forests, and you can see it.
Speaking of fires, yeah, one of our favorite places, Cache Creek.
Yep.
It's a 7-mile hike out along the Cache Creek into a place called Wilson Valley, and beautiful big oak, rolling hills. Gets that, you know, some morning coastal fog a little bit.
But yeah, burnt down. I mean,
Burnt down.
Most of that area was just under fire, and we've had just some historic fires, and you can see it not just in the fires themselves, but the areas that haven't been touched, the dead trees just from the drought.
Yeah.
And I forget what I wish I had the statistics, but of how many dead trees are, what percentage of the forest is just dead and ready to be lit on fire. It's kind of crazy.
Yeah, those dead trees allow the heat to go up considerably. So in a healthy forest, you have big trees that are kind of spread apart. Fire comes and hits the undergrowth. It doesn't actually impact the tops of the trees to kill them entirely, and the forest can rebound. But the way we do foresting out here, and we got tinder stacked on top of tinder, stacked on top of tinder, just burns, and then you get clear-cut conditions, essentially.
Yeah. Yeah, so as an outdoor enthusiast, you and I, how does this affect you? Like, how has your mind changed around being outdoors in California? I think the smoke when there is a fire is pretty awful. They close down parks.
I mean, that's how I unwind, right? Like, if I'm not at work, I'm at home enjoying the family, and I'm probably thinking about how can I get the family out into the woods to enjoy them even more.
Right.
So it's been impactful to us. We just, on this vacation, we took 2 weeks going all the way up to Olympic National Forest in Washington. We did our first stop at Hell's Gate Campground. It's on the South Fork of the Trinity River up in Northern California. Just picturesque, beautiful river system, turtles, Jurassic Park looking water plants that have leaves, that are 3 feet across that my daughters could stand underneath in the middle of the creek. Those are still there, but everything else around it just charred to the ground. The rope swing that I used to go off of as a kid, starting at 10 years old, the trees burnt down, no more rope swing. So we got there, looked at it, not even a place to camp. We just left.
Oh, yikes.
So I think that's 30, 40 years before that place has an opportunity to have trees again.
Yeah.
So, I mean, I guess one of the things to take into consideration is, if you're pretty well off, hey, I can take a 2.5-hour drive, 3-hour drive and afford it with the crazy prices of gas. But if now what you need to do is like leave California to go see something that's not burnt down, it probably gets out of your range, where it just makes more sense to stick around home.
Yeah. We pulled some metrics. I found some on healthaffairs.org. There's a report from 2016 talking about leave in general, mostly paid leave, and how that affects the mental health of employees. And if an employer is providing paid leave, how does that affect people taking leave? And I thought that was, I don't know, it was an interesting metric that when an employer does not have paid leave, that they are 3 times less likely to take time medically that they need, and 1.6 times less likely to take time off for a family leave need.
And I would imagine on the scale of income, the less income you have, right, more likelihood that you have like less vacation time and things like that as well. So it's definitely going to hit the people that are probably having the hard jobs that are work comp related in the first place, right? You know, ag and construction, things like that.
Yeah. So there's a direct correlation, you know, between employer paid leave and workplace injury too, right?
Yeah. So how do you get people to go take vacations, you know, that don't have a lot of compensation in their life, so they got to save up for it, but then they have to travel further to get to something that's like intact? Like Yosemite right now is burning. The sequoias are at risk, right? Some of the largest trees in the world.
Yeah.
So then you can't go to Yosemite. Where do you go? You go to Nevada?
Yeah, I don't know if there's an answer. I think that this is just an interesting, interesting and I think logical for a lot of people. The employer paid leave contributes positively to health, to workplace injuries, to stability, retention, productivity. And said, what is it, 70%? I just looked this up, and there's 70% of Californians have some paid leave policies.
That's good.
Which is good.
So I got some metrics for you too. So it says 60% of employees who don't feel they have appropriate work-life balance are concerned about not having time to take care of themselves in terms of health, diet, and exercise. And that was a Harris Interactive survey. And then it says consistently working long hours and not taking respite away from work can have damaging effect on health and can negatively affect family life. A 9-year study reported in Psychosomatic Medicine found that vacations actually reduce the risk of heart disease. Men were 30% more likely to suffer a heart attack than those who took a vacation at least once a year. And then for women who took vacation once every 6 years or less were almost 8 times more likely to develop coronary heart disease or have a heart attack. Wow. So get out and take vacation. I know there's people that like, they just try to push through. They save up the vacation, but use it.
That was going to be my conclusion is don't let these fires, don't let these things bum you out, that there's not, that you can't go take time. Like take time. There's some beautiful spots that are protected by our concrete, barriers. Some beautiful places, you and I find those places that are less susceptible to fire specifically. But I think that's the point is you and I have found respite and relief in the outdoors. We think that everybody should explore it. It's God's gift to us, and
definitely
explore it. And don't let the fires bum you out. Don't let, they're here. I don't think they're going away anytime soon here in California, but get out there. It's good for your health. It's good for your employees' health if you have employees.
One other thing, I wonder if this has been brought up, just thinking about fires and workers' compensation, is you mentioned the smoke. And last year during deer season, which is coming up right now, in fact, I was supposed to go scouting this last weekend and I missed that, but I was wearing a mask, an N95 with a machete hacking through a bunch of brush. And it was a little brutal, a little bit of sweating going on for sure. So, I'm fortunate enough to, have the education and access to information that says, if you're going to be in the smoke, wear an N95. But what about like all those ag workers, they're in the fields outdoors all day long, construction workers outdoor all day long, and they got this smoke conditions. Like our employers like making people take mandatory time off because of these conditions? Like, and then what does that do to the agricultural supply chain? Like, there's a lot that these fires can impact besides the force themselves,
And I think that that's a good segue to what we've seen with COVID. And talking about COVID, SB 1159 was enacted in 2020, September 17th exactly, 2020. Specifically to give a rebuttable presumption for employees that contract COVID-19 at work as a result of their work, with a couple of exceptions that were specifically non-rebuttable medical workers and like EMTs. This question of what causes or what environmental things cause workplace injuries that are quote unquote compensable. That means that they've been deemed liable to the employer. This Senate Bill 1159, enacted in 2020, is set to expire, in January 1st of 2023, which is in 6 months or so. That's an interesting, I think, concept that's new-ish, to us. And it begs to, it brings that question. If fires are happening in California and you're an ag worker, you're dealing with smoke inhalation, is that compensable? Is that liable to the employer?
I think it should be. It would make sense. Like, the employer should have to provide the proper training to wear a mask that can prevent smoke damage and wear it properly, right? If they're doing those actions, then I think that it shouldn't necessarily be on the employer. But if they're putting you out in this like conditions where the government, the CDC, is like saying, hey, this is extreme danger from smoke inhalation, like, obviously.
I guess it's no different than like a chemical exposure. If you're a field worker and you're exposing yourself to the pesticides that have been put into the field.
I mean, so with smoke, like, maybe the employer wasn't aware that the field was smoky that day, or maybe there wasn't any smoke when they started and then the smoke came about. With pesticides, you're dropping the stuff on people. Like, you better be sure that there isn't people underneath you.
Of course.
Right?
But even if they're working the soil, the pesticides are getting into the air.
Yeah.
It's interesting. Yeah. So
I read a study the other day. Don't quote me on where it came from. 80% of people in the United States have Roundup in their blood.
80%.
80%. Detectable amount of Roundup in their blood.
Oh my goodness.
Yeah. They've been pushing on trying to get rid of that stuff for a while. So,
yeah.
I mean, those ag workers, they're in direct contact.
But you were asking, how is this even possible that you can, this can be a workplace injury?
Well, okay. And I think it should have been initially, because the CDC and the government is putting mandates on employers to non-essential work. Like, if
protect their employees,
if they're not taking the right actions during that time of mandates to protect their employers, then sure, make them liable. But I think we've got to a place now where it's like so rampant. In fact, this BA5 is the newest version. It's like really increasing the rate that people are getting, and even the people that have had it previously and boosted or whatever, they're still getting it like even a month too later, because the thing is so transmissible. How is the employer supposed to stop that? Can you stop the common cold? Are you responsible for the common cold? Are you responsible for the flu? Like, at this point, there is no mandates. There's recommendations. So the employers are taking all these causes. Like, it would be really sad to see someone get COVID and then the workplace be responsible for it, when really, how can you prove those types of things? And I'm not an attorney, so maybe the attorneys out there are listening and saying, I can tell you how to do it. And in that case, I'm just ignorant, right? But I don't know. I think it's interesting. And I think that 2023, that's good. Like, we need to get that out of the system and normalize it.
You mean that it's expired?
Expired, yeah.
January
like, if they continue that, I don't know, that just seems a little much on the employers.
Yeah, it just is a question. Where do you draw the line? Pesticides versus a virus. As an employer, I know that there are viruses out in the world. What am I obligated to do in order to protect my employees?
Yeah, I mean, we have signs posted to wash your hands for like 20 plus seconds or whatever, and all the things are recommended by the CDC, but there's not much you can do. I can come in right now. I feel like I got to sneeze a little bit right now. I could have COVID accidentally sneeze before I have any symptoms, and then everybody in the room gets it. Are you now all of a sudden liable for me to go out on a work comp claim?
Based on this current bill, yeah, I am.
I wonder how it's benefiting the attorneys, like how many claims they're actually getting for work comp, and then what type of, settlements that they're seeing for that. I can't imagine they would be too high unless, of course, the work comp turned into something serious. Oh, and then here's this, all right, pre-existing conditions. You have someone that's, maybe obese, maybe smokes cigarettes and does all these other things, and then they get COVID, and now they get long COVID, maybe have kidney damage or something crazy. Obviously, from a settlement perspective, it would be worth a lot more. How do you, show that only this percentage of your COVID was due to COVID, and because you were obese and smoking cigarettes for 30 years of your life, like, some of this other issue you had could have come from that.
I've heard this discussion several times from the attorneys, and it literally just becomes a negotiation, and you're not. I feel like I don't want to actually step into what the legal kind of wrangling or the how do they do that? How do they juggle between pre-existing conditions and the workplace incident or workplace environment? Glad I'm not an attorney.
I was going to say that's why we have attorneys.
Yeah, exactly. They get to wrestle with that, and I'm sure there's an answer there, and we're just not. Yeah, we're ignorant, not trained in that area.
Well, it seems like more and more people are getting COVID. I think it's not as deadly as it once was, right? With these new Omicron strains, it seems like it's kind of more like a common cold. Comparatively, still people are getting hospitalized. In fact, hospitalizations are going up right now in California. That's a 66% increase in hospitalization from 5 weeks ago.
Wow.
This is out of SACB, looking at some documentation.
Yeah, interesting. Our final topic is finer points of the copy service fee schedule. We are on the doorstep. So July 15th is the activation of these new fee schedule regulations.
4 days from today.
Yeah. There's a couple of things that myself and several of my colleagues have been discussing, and how do we handle them. One of them is the unpaid. This is 9981. It says bills must be paid or contested within 30 days of receipt, and if it is not paid within this period, the unpaid portion will be increased by 25%. There's some questions on how hard we go on this, because the likelihood of being paid in 30 days is pretty low. That's been the discussion. How hard do you go on this? Where the insurance companies we feel are going to have to adjust to these things, and a lot of times they don't even adjust until after it's activated.
I mean, I may be a little cynical here, but I say go hard. Like the last fee schedule, right? The insurance companies won out big. They got a huge reduction, and then their decision was, we're just going to stop paying the copy service providers entirely.
Yeah,
and we had to build a gigantic system. So why should I care about that? I mean, obviously the system and the industry, you want to make sure everything is kind of harmonious, and the end result is that the injured workers are being taken care of properly. But these insurance companies make a lot of money. So, we need to get our fair share. We've been suffering for a long time, trying to make sure our quality stays up to par and we can support the attorneys that represent injured workers. It's past due.
Yeah, I think you're right to present that side of it, and we all feel that have been in and around what happened in 2012 through 2015. As a reminder, we got annihilated from a collections perspective starting in 2012. And this was just the mention of a fee schedule back in 2012. Legislation came through to regulate copy service fees in August of 2012. Leading up to that, though, just the discussion and thought of having a fee schedule caused our accounts receivable to go out of control. Mm-hmm. And it was an incredibly difficult time as a business owner to navigate that time. 2012 was awful, but we were still unregulated, so we could charge what we needed to charge in order to be, healthy. But fast forward 2-3 years later, so this is July of 2015 when we finally got a fee schedule, and the idea was that because we had a fee schedule that we would be paid on time and in full. Not the case at all. That though fee schedule was a 40% reduction from the average of what we were charging and the industry was charging and being paid up until July 15th of 2015, a 40% reduction to that regulated fee. So, yeah, Frank, I mean, and we were not treated well during that time by our payers. And so there is that, a little bit of jadedness, a little bit of cynicism that says, you know what, let's go hard on this 25%.
I think we need to from an accountability perspective as well. If we let people slide, they're going to want to take advantage of that. Mm-hmm. That's just the nature of that big corporate conglomerate type business.
I think too, it's important to think, to consider that it's not personal.
Of course.
I get it that the insurance companies, it's a big company. It's a big organization for them to adjust to these changes and any changes, and 100%, like, we should hold them accountable.
I mean, we're adjusting. We have to adjust too. So, like, everybody, there's law. They give you time to look it over. This has not been something that's just showed up yesterday. This has been going on for years. So
the nice guy in me wants to not go hard, but the business side of me says go hard. I think the danger thing to highlight if you go hard is that you could possibly damage relationships within the industry.
You give grace. I mean, if they're communicating, hey, we're trying to adjust systems, then yeah, you can give some grace.
Right.
If they're, just trying to string you along and they're not showing like genuine interest to, do what is legally required, then you can lay down the hammer, right?
Yeah. Yeah. The other fine point that is coming up in debate again with my colleagues is the third-party ROI services. Now, these are the fees that the custodian charges to obtain the records, to produce the records for us. Background: the custodian is the medical provider normally that has custodian of the medical records. They generated them, they house them, they archive them, etc. A lot of times these medical providers and provider networks, they hire a third party, what we call ROI company. It's called release of information. ROI stands for release of information. These third party ROI services are very large companies that work with, again, hundreds and lots of providers to outsource their release of information. There's benefits there for the hospital, for the provider. The ROI company understands the laws, or they should understand the laws. Historically, what has happened is that these ROI services and companies, they are supposed to be charging per the evidence code, the California evidence code, and have a lot of them, and a lot of times have blatantly ignored those evidence code fee schedules, and just charged whatever they felt was they could charge us in order to generate the records. Okay, we've been talking to the administration for many years about this issue, the overcharging, because it's not really we're just trying to obtain them, and this is for the case.
Yeah,
we get held hostage by the custodian and the ROI companies to get these records based on how much they want to charge. And sometimes it's completely exorbitant, and a lot of times, and it is in blatant conflict with the California Evidence Code. Okay.
And more often than not, we call it a lost leader. It actually cost us more money to go get the records, deliver them back to the attorney to, do their magic than what we get to collect.
Right. Yeah. So the administration helped us out. Regulation update to Regulation 9984, the subsection that says that the ROI, third-party ROI service that represents the deponents or witnesses who are compelled to produce documents for a deposition shall be paid a flat rate of $35, inclusive of the witness costs and all services provided by the third-party ROI service when records are produced, or a flat rate of $15, inclusive of witness fees. So they helped us out. They gave us this $35 flat fee, which is good. That's very good. The overcharging has been, I think, a lot excessively over that in many cases. So this helps out these one-offs. On an average, I'm wondering if we're saving any money. I'm not sure.
I would like to think so. It depends on if they, maybe previously they were charging less. $35 sounds like an inexpensive ROI fee. Like I think they've got up into like the hundreds of dollars based on page count and things like that. Right?
Yeah, no, I think that it definitely helps, especially in one-offs. There's these one-off situations where they're just charging an insane amount of money for whatever reason they make up, and we can mitigate that to make sure that nothing is a lost leader. Really is really great. They also gave us a path to go to the court based on a conflict that we have or dispute that we have on with an ROI company, and it's in 9985. It says disputes over production of records may be resolved by filing a petition with the Workers' Compensation Appeal Board or by filing a petition with the Superior Court pursuant to Labor Code Section 132. So
sounds like a lot of work for us. Is what it sounds like. It sounds like,
yeah.
If I had a crystal ball in front of me, it says you're gonna have to fight for your money.
That's what that says to you, huh?
Yeah, and I think some of the companies may be quick to respond, but like you're talking about a lot of different medical companies out there that probably charge this, and are they going to be able to get with it quick?
Yeah. So the concern of the discussion that we're having is what happens when they do overcharge beyond this. And there's several kind of catches that go on here. Number one, we are not a party to the case. We're being charged this fee, excessive fee, and we're not a party to the case. We're not actually the aggrieved. We're not legally aggrieved, I guess. So how do we go about this? Do we charge? Is everything that goes above that $35? Do we go to the court for? It's still up for debate and how we're going to navigate this, but we do have a path to go to the WCAB. We're bringing this up. We're talking about just some finer points of what's going on with the copy service fee schedule regulations and some internal discussions, again, with colleagues on how we're going to deal with these things. So those two items are still yet to be kind of solidified and how that's going to go.
I think those are the that's the type of law that you have to actually do the work before you know what the result's going to be. Right.
So yeah, those are two of the finer points: the 25% bump, not paid in 30 days, and then the $35 cap on ROI fees. How are we going to be navigating? It's. Do we go hard? Do we go soft? What's the cost going to be to produce or to pursue both of these avenues?
I'm curious what the attorneys would suggest. You know, I would imagine the ones that we're servicing are going to say, "Yeah, get your money."
Yeah.
You know.
Yeah. Yep.
And if it doesn't put any burden on them to get the cash, like,
Mm-hmm.
maybe like a lien or something like that may have done in the past. Yeah, I'm sure they're wanting us to, the more we make and the more profitable we become, the more we can invest back into the system that supports the attorneys to get their jobs done easier.
Yeah.
Right. So we're finally at a place now after many years where we can start to think about those things a little bit deeper.
Yeah, 40% decrease in 2015. We're getting 27% of that back, or 27% increase. So it's definitely welcomed. And these finer points will be, they'll be played out in the WCAB. So we'll see how that goes.
We need to start getting some metrics on the ROI fees and seeing how that goes.
Yeah. We'll see how that goes.
Anything else fee schedule?
No, I think, like I said before, the only thing that comes to mind is like how are the insurance companies going to respond? How are they going to adjust? There's concern. There's concern that the whole system just slows down because of these changes. That's probably the biggest thing, and how do the changes affect the day-to-day?
I'm pretty sure the slowdown should only be in relation to payment, hopefully, and not the actual procurement of the records. I mean, that would be very detrimental.
Right. And I think that's a great point. I'm glad you bring that up. We don't see anything that is really, going to specifically affect attorneys getting their records.
Okay.
That's not what this is. The fee schedule is really about. It's just about kind of clarifying how we operate business. But your records are still going to come on time as they would normally. Just have some for you attorneys out there, have a little bit of grace with us as we navigate, and the insurance companies.
What about the employers? Do you feel like the employers are going to be taking on the brunt of this cost?
Well, I'm not exactly sure how the dance goes between the employers and the insurance companies, but it's a finely tuned machine. So basically, actually, the recent history is that the cost of workers' compensation is down. Over the rhetoric out there is that the changes that happened in 2012 have been very good for the employers and for the insurance companies. Yeah. So, for context, there's a 2011 liens report stated that copy service, the cost for copy services was less than 1% of the total cost of med legal fees. I'm probably misquoting that slightly, but so that the consequence of this is pretty, I think, minimal.
All right,
for those guys, minus the 27% increase, but again, less than 1%. 40% decrease, 27.
Yeah.
So they're cool. Yeah. So, yeah. Well, I think that should wrap up our discussion. Yeah.
Mm-hmm.
Yeah. So again, we'd love to hear from our audience. Subscribe, like, follow, and comment. Again, we're excited to hear your feedback and ideas on new topics. Yeah. As always, it's been a pleasure, Frank.
Yeah, it was good.
Great, man. We'll see you next time.
All right. Thank you very much.